Hi, my name is Leanne Foreman. This is my psychiatric history interview for NR 548. I give my permission for Chamberlain University to record my interview and share it for grading purposes.
My name is Zachary Foreman. I give permission for this interview to be recorded and submitted to Chamberlain College of Nursing for grading purposes.
Okay, Zachary, can you tell me your full name?
Zachary Styles Foreman.
And how old are you?
44.
Okay. And Zachary, in your own words, can you tell me what you're here for today?
I'm here because my wife suggested I come in. I haven't been sleeping like 4 days. I haven't slept. I don't know, feeling kind of invincible, like on top of the world. Nothing can hurt me.
All right. And when did you start noticing these symptoms?
About 3 or 4 weeks ago. The last 4 days, it's been really bad.
Okay. And can you elaborate a little bit more on the symptoms you're having, what you're experiencing, or what's been going on in your life when this started?
Me and the wife been having some problems. I haven't been sleeping. My thoughts are racing. I just feel off.
Okay. And on a scale of 1 to 10, how would you say these symptoms are affecting your life?
It ranges from like maybe a 5 to 10 when I'm really going.
Okay. And is there anything that's helps make them better? Is there anything that you do that makes you feel better in general?
Not recently, no. I just lay around on my phone all day.
Okay. And are you currently how long are these thoughts going on for? Like, are they, a few minutes to hours?
It's nonstop.
Nonstop, okay. And any, time of the day, do you feel like it's worse? Like, if you're doing something, are you able to, kind of put the thoughts to the side? Or are they, taking over your, everyday life?
It's totally taken over. I can't turn it off.
All right. And do you currently work?
I did. I recently quit my job. I walked off.
Okay. All right. And was that, so you don't have a job lined up?
No.
Okay. And what have you been doing in the meantime?
Well, I did a bunch of shopping, spent a bunch of money, and I don't know. That's the only time I can turn it off. I just went out and spent a bunch of money.
Okay. So are you in financial trouble now?
Yeah, but it ain't a big deal.
Okay. How much money did you spend?
About $25,000.
In how many days?
3.
Okay. And so is that leading to problems with your wife?
Yeah, she's not happy about it.
Okay. Do you have an idea of how you guys are going to recover financially?
Money comes and goes. It's not a big
deal. Okay. Zachary, do you have any allergies to anything?
Seasonal and dogs and cats.
Okay, what about medication or food?
No.
Okay, and for the allergies for seasonal and cats and dogs, what happens?
Eyes watery, itchy. Some dogs make me break out in the hives. Some cats do.
Okay. And do you take any type of medication?
Claritin for the allergies. Symbicort and Singulair for asthma.
Okay. Can you tell me any of the milligrams on this?
Singulair is 10 milligram.
And how many times a day?
Once.
And how long have you been taking that?
So I was 18.
18, okay. And then you said, what was it, Symbicort?
Symbicort. Oh, and Zoloft, too. Forgot about the Zoloft.
Okay, so the Symbicort, how often do you use that?
As needed.
And how long have you been taking that?
So I was 18.
18, okay. And then you mentioned Zoloft?
Yeah.
How many milligrams?
100.
Okay. So you have a history of, in how many years?
2 years.
2 years, okay. And you take it daily?
Yeah.
Okay. So you have a history of, what were you diagnosed with?
I was diagnosed with depression when I was 18. I put off really seeking help for it until a couple years ago.
Okay. So when's the last time you seen a psychiatrist?
Right now.
Okay, but you're on Zoloft.
Yeah.
So how did you get that?
Like 6 months ago, I went in for a visit.
Okay. All right. And so you're on the Zoloft for the depression. Have you ever taken any mood stabilizers or antipsychotic medication?
No.
Okay. And do you have any suicidal ideation or thoughts of harming others?
Not now, no. When I was 18, I did.
Okay, so when you're 18, you had some depression then, you thought about harming yourself?
Yeah.
Okay, but you didn't seek any treatment then?
No.
Okay. All right. And then do you have any family history of any psychiatric?
My mother was bipolar. My dad had depression. I had an uncle, who was a bad alcoholic.
Okay. And then your grandparents?
I don't think so.
Okay. And then any of your siblings?
No.
Okay. I know you said you had asthma. So you're any other medical history like diabetes, hypertension?
No.
Okay. So the only medical history you have is asthma?
Yeah.
Any surgical history?
No.
Okay. All right. And then family didn't have any history of like diabetes or any hypertension?
No.
Okay. All right. Have you ever been hospitalized? For your depression?
No.
No. Okay. And any other like psychiatric hospitalizations?
No.
Okay. And then, do you drink or smoke or get high?
No drugs. I drink occasionally.
Okay. What's occasionally?
3-4 times a month.
All right. And then you said you don't smoke marijuana or you don't smoke?
I don't smoke marijuana.
Okay. And any nicotine?
Yeah, I vape.
How often do you vape?
Every day.
Every day. Okay. And then have you ever done any recreational drugs?
When I was younger, like 20 years ago.
Okay. But you don't do that anymore?
No.
All right. Okay. And then tell me like what your day-to-day life looks like. You have wife, you said your wife's upset. So you have your wife and your kids or?
Kids are older. 3 of them are 20 and up. The youngest is 15. Day-to-day life was just get up, go to work, come home.
Okay. And what do you like to do for fun?
Barbecue, play basketball, swim, play with the dogs.
Are you still doing those things?
No.
No. So since you quit your job, you've been spending, doing some spending, and then also having some. Would you say are they considered like low periods?
Yeah, very low periods. Don't want to get out of bed. Don't want to eat. Don't want to talk to anyone. Just isolating myself.
Okay. All right. So, so you're saying are you super tired? Or like fatigued?
Yeah, a little bit. Just don't have a drive to do anything.
So that's more when you're feeling low.
Yeah.
And then when you're feeling what you're calling high, what are you experiencing then?
I'm just zipping around, running up your credit cards.
Okay. And your thoughts during that time?
I don't know. I want this TV, so I'm going to buy it.
Okay. And you said, are you eating okay?
When I'm feeling good, I eat a lot. When I'm not, I really don't eat at all.
Okay. And has there been any like weight gain or weight loss?
Yeah, when I'm not eating, my weight always fluctuates 10 pounds. But when I'm not eating, it drops.
Okay. But you're not intentionally trying to lose any weight?
No.
Okay. So sometimes it goes up and sometimes it goes down?
Yeah, that's just my body.
Okay. All right. And then you said you have seasonal allergies and with the dogs and whatnot. Do you have any like rashes on your body? Any skin problems?
Only when allergies might flare up. But.
Okay. Any trouble with your ears or nose or your throat? Any trouble breathing?
No.
Okay. Any nosebleeds?
No.
Okay. And when you have an asthma attack or asthma symptoms, what are they? Are you wheezing, coughing?
Yeah, wheezing, coughing, short of breath.
Short of breath, okay. But those are mostly controlled with your singular and your inhaler?
Yes.
Okay. All right. And any trouble with your belly?
No.
Okay. So you have normal bowel movements. You can control your bowels?
Yes.
Any constipation?
No.
Okay. And then no nausea or vomiting?
No.
Okay. Any trouble urinating?
No.
Okay. And are you able to hold your bladder throughout the night? No accidents?
Yes.
Okay. Are you, experiencing any like pain on a daily basis?
No.
All right. So nothing, you're able to do activities. So I know you say you used to do a lot of things, but no pain is causing you to not do these.
No, it's nothing physical. Just my mind.
Okay. And then have you ever been diagnosed with like a blood disorder, having like anemia, any thyroid problems?
No.
Okay. Any excessive sweating or being cold?
Only at night.
Okay. You're cold? You're having night sweats?
I wake up sweating sometimes because my wife keeps the room freezing.
Okay.
Yeah. And we got a big blanket, and I'm trying to stay cozy.
All right. Any history of diabetes?
No.
No. Okay. All right. I think that is the basic questions that I needed just to get your initial history. And then we'll talk about some therapies and stuff that we can go over for you.
Okay.
Okay. Thank you, Zachary.